Happy Saturday. This is Nurse Eunice with Florida Training Academy. And this evening, we're going to review 60 practice questions to help you pass your CNA examination. And I am so excited to have you. If I've not told you yet, Happy New Year. And we will get started in 10 seconds. Let's do our quick review. All right, so team, question number one. Why is early detection of flu symptoms critical in healthcare settings? A, to isolate the patient immediately. B, to prevent the need for PPE. C, to administer antiviral medication within 48 hours. D, to avoid unnecessary hospitalization. I hope you've been having a great weekend. I'll reveal the answer in 5, 4, 3, 2, and for this one, it wasn't specific to CNAs. So for this one, the actual answer is going to be C. Even though you don't administer the medication, the reason why we need to be monitoring those flu-like symptoms is so that we can give them their antiviral medication. So great job if you chose C. Antiviral medications are most effective when administered within 48 hours of symptom onset, reducing the severity and duration of the flu. Question number 2. When working with a client who has urinary retention, the nurse aide can expect the client will A, urinate large amounts or large volumes, B, be unable to urinate, C, urinate frequently, or D, be incontinent of urine. When someone has urinary retention, what is your expectation? All right, revealing the answer in 3, 2, and hold up. Congratulations, Miriam. Oh, my babies grew up so fast. Congratulations, sweetheart. All right, so everybody, if you chose B, you got it. That is correct. Urinary retention is the inability to empty the bladder, which may lead to discomfort, a distended abdomen, or the need for catheterization. So if you all can do so, please give Miriam applause, tell her congratulations, because she's been studying hard, preparing for her CNA test. Great job. Question 3. A CNA notices that an indwelling urinary catheter has become disconnected from the drainage bag. What should the CNA do first? A, reconnect the catheter and drainage bag without further steps. B, wipe the catheter and drainage bag ends with alcohol and reconnect them. C, wash hands, don gloves, and notify the nurse immediately. D, clamp the catheter and wait for instructions from the nurse. And good luck in advance, Kelly. I know you're going to do great. All right, revealing the answer in 5, 4, 3, 2, and this one's tricky, you all. It's not C. Hopi has it. Great job, Hopi. It is B. Otherwise, urine's just free flowing. So I need for you to reconnect that system and then notify the nurse. So if a catheter becomes disconnected, a CNA cleans the ends with an alcohol swab to minimize the risk of infection before reconnecting them. After reconnecting, the CNA should notify the nurse to ensure the situation is properly documented and monitored for any signs of infection. Question 4. The best way to identify your patient is by A, asking his name, B, calling his name and waiting for his response, C, checking the bed plate, oh, that's really old school, or D, checking the armband. How do you verify your patient's identity? All right, revealing the answer in 3, 2, and everybody has it. It is D. That's right. We're going to verify the patient's identity using their armband that ensures accuracy and safety. Do not just go up and ask someone if that's their name, because if they're confused, they might say yes, and you may end up giving or providing the wrong care to the wrong patient. So look at that armband. Question 5. A client is on a bladder and bowel training program and has not had a bowel movement in 3 days. What is the nurse agent's responsibility? So is it going to be A, report to the charge nurse, B, give the client an enema, C, offer the client prune juice, or D, encourage the client to drink more fluids? He hasn't pooped in 3 days. That's right, Nasamba. That's right, Miriam, Adanita, Mila, and Bibatu. You have it. It is A. Yeah, you need to let the nurse know about that. No amount of prune juice or fluids is going to help at this point. We need to go ahead and send in the big guns. We probably need some laxatives, a suppository, an enema. The nurse needs to get involved. So prolonged lack of a bowel movement may indicate constipation or other issues that require medical intervention. It is essential to report this to the charge nurse to address the situation appropriately. Question number 6. Let's see if you know your medical abbreviations. The proper abbreviation for before meals is it PC, BID, AC, or TID? And I know you got this because you all have been studying. I can't think of a question they can ask you on your test that I haven't already covered. All right, so revealing the answer in 3, 2, and that is right, Zevany and Latrice and Danita and Claudeni. You have it. It is C. AC is the correct response. That means before meals. Question number 7, and we're doing this fast paced because I'm coming on tomorrow with another video. All right, so question 7, why are healthcare workers encouraged to get the flu vaccine annually? So that's right. Once you have your CNA license, they're going to be giving you all these vaccines. So why do we encourage it? A, it provides lifelong immunity against all flu strains. B, it ensures compliance with workplace safety rules. C, it prevents the need for PPE during flu season. Or D, the flu virus mutates yearly, requiring updated protection. Revealing the answer in 5, 4, 3, 2, and your term. I see A, B, C's, and D's. All right, so the reason why you have to get a flu vaccine, or at least they will recommend that you get a flu vaccine annually, is because we never know what strand is going to be out there. So the correct response is D. The annual flu vaccination is necessary because flu strands change yearly and updated vaccines offer the best protection. Yes, Mila, it is not lifelong. All right, so question number 8. A patient who has dentures who doesn't have dentures. Let me rephrase this because I have a typo there. So a patient without dentures will need what type of diet? Is it clear liquid, low residue, pureed, or mechanical soft? If they don't have their dentures, Miss Nancy's newly admitted, and she left the dentures at home. She doesn't have any teeth. What would be the best diet for her? And everybody has it right. It is D. She wouldn't need pureed. Pureed is for those with swallowing problems. If it's just the fact that she doesn't have her teeth, if she doesn't have dentures, a mechanical soft diet consists of foods that are easy to chew and swallow. This diet accommodates clients with chewing or difficulty or swallowing difficulties while maintaining nutritional adequacy. So instead of getting a hamburger, she'll probably get a Salisbury steak with some gravy and also some mashed potatoes. So it's something that's not in necessarily a pureed state, but it's a softer meat and also softer vegetables and starches. Question 9. A CNA notices a patient with diabetes experiencing confusion and sweating. What should be the CNA's first action? A, call the nurse immediately. B, offer water to the patient. C, check the patient's blood sugar level. Or D, administer insulin. Patient with diabetes is confused and sweating. I'm so proud of everybody. Yay! Crazy nurse dance. I am so proud of you all. You all did not step outside of your scope of practice. You are notifying the nurse. Great job. And so the reason why you want to call the nurse is because confusion and sweating are signs of hypoglycemia, which you all were aware. That means low blood sugar within the bloodstream. That's a medical emergency. Anytime there's an emergency, you're notifying your nurse. So CNA should notify the nurse immediately, who will assess the patient and decide on the appropriate action. Because if this patient is unable to swallow, even if the blood sugar is low, that means the nurse would not be telling you to go get orange juice. If the person is unable to swallow because they are now unresponsive, the nurse will be starting an IV and giving intravenous dextrose. So getting your nurse in there is so important to make sure that that patient gets the proper interventions. Question number 10, how often should a patient's intake and output records be totaled? Once a shift, twice a day, every 4 hours, or whenever the patient requests an intake and output be totaled? Oh, my Mila. I appreciate you also, Mila. Mila, you've been studying. I'm so proud of you. And you know what? You can still do pediatrics. So if you're interested in childcare or daycare, remember, once you're a CNA or a nurse, you can still work in a children's hospital. So you can fulfill both purposes. You can take care of kids and be a nurse or a CNA. All right, everybody, revealing the answer in 3, 2, and 1. Yes, it says once a shift, but pretty much anytime you get opportunity to chart, you want to get in there and chart. So intake and output records are typically totaled, at the end of the shift, prior to, let me repeat that, you all, at the end of each shift to monitor the patient's fluid balance and detect any issues such as dehydration or fluid retention. So let me correct my statement. You would document whenever the patient consumes something or whenever they urinate or have a bowel movement, but then the totals are done at the end of each shift. So I stand corrected. Question number 11, which of the following should the nursing assistant observe and record when admitting a client? So which of these would be a priority? Is it freckles, wrinkles, short nails, or bruises? All right, revealing the answer in 3, 2, and yes, life is beautiful. And Chantel and the Samba, Davita. Hold up, I saw a question. I have to go back to that question. It is, you are all correct. It is D, bruises. All right, and so Clean, I don't know where you are. So the best place to go to get your fingerprints is going to be identigo.com. That's live scan for Florida. So if you're in a different state, you want to be contacting the live scan agency for that state. Usually you can just Google it. But if you go to identigo.com, you can schedule fingerprints. We do them in our office in Jacksonville, but I'm not sure where you're located. All right, so I hope that helps you. And Identigo's information is in the chat now. All right, so question number 12. Which of the following is an example of falsifying documentation? Is it A, charting care before providing it? B, documenting care immediately after providing it? C, correcting a mistake with a single line and initials? Or D, recording vital signs taken by the nurse? And you're so welcome, Clean. Hi, Ai from Texas. Yes, Kelly. In order for you to get your CNA examination date, they're going to do a background screening on you. So the process is, because we have some people who may have criminal histories who may be ineligible to become CNAs. So before you take your test, a background screening will be needed based on the state that you reside in or where you're testing. The requirements may differ. So it's always best to either check with your program, whatever school you're in, or to check with the state testing agency. All right, you all. So falsifying documentation. An example would be A, charting care before providing it. So documenting care before it is delivered is falsification and could result in severe consequences if the care is not actually provided. All right, so let's go to question number 13. Which action is most likely to protect your professional license? Do not go to jail, y'all. Don't be doing crazy stuff. I love y'all. Is it A, completing tasks without following policies? B, delegating duties without verifying competency. C, following facility protocols and documenting accurately. Or D, relying on coworkers to handle patient emergencies, which is most likely to protect your professional license. You've worked hard, you've studied, you don't want your license being taken. So how do you protect it? Revealing the answer in 3, 2, and you all are correct. You're going to follow those protocols. So adhering to facility protocols and maintaining accurate documentation ensures patient safety and protects healthcare professionals from legal or disciplinary actions. Question number 14. When arranging a client's room, the nursing assistant should do all of the following except A, check the placement of the call bell. B, adjust the backrest as directed. C, adjust the lighting as appropriate. D, administer the client's medications. You do all of those except which one? That is right, Davita. Unless you have taken an additional course and your state approves it, that's a lot of ifs, you would not be given medication. So whenever you're taking your CNA test, this is just a basic level test. You do not give medications at this point in your career. Question 15. When assisting a client out of bed, the nurse aide should always A, lower all safety rails. B, get another nurse aide to assist. C, raise the bed to its maximum height. D, employ body mechanic techniques. All right, and let me answer this one. Yes, because of the holiday. So if you still don't have any updates by Monday, I would call Prometric or call FDLE, like in the state of Florida, it's the Florida Department of Law Enforcement. There's a toll-free number, but just check back. Because of the holiday, they're usually understaffed. And even though FDLE or the fingerprinting company did their part, the state agencies are closed. So it's going to be hard for you to get an update over the holiday season. Things just slow down. So just be patient with them, but do follow up on Monday if you have an opportunity. All right, so question 15, the answer is D. Of course, you're going to employ body mechanics. Proper body mechanics, such as bending at the knee and keeping the back straight, prevent injury to both the client and the nurse aide. Question number 16. A patient dies due to neglect, and the CNA assigned to their care failed to document rounds, meaning that you didn't go and document that you watched or you looked in the room every hour or that you turned them every 2 hours. You didn't document that. What is the likely consequence for the CNA? A, a verbal warning. B, suspension of employment. C, termination and potential legal charges. D, no consequences if no one reports it. That is right. You all check on those patients. Do a visual check every hour. Walk around. Make sure their chest is actually rising and falling. Just because someone is sleeping, they may not be sleeping. They may have expired. So actually pause. Make sure they're breathing before you go to the next room. And then every 2 hours, you change your patient's position. So if you chose C, you are absolutely correct. And when we say potential legal charges, that means that you could actually end up in jail. Okay, so we don't want that happening. Question 17. Which of the following foods should a patient with celiac disease avoid? Is it oats and rice, wheat and barley, corn and quinoa, I always mispronounce that one, fruits and vegetables? All right, so revealing the answer in 5 seconds. And if you've not heard of the nutritional requirements of a patient with celiac disease, I want you to get pen and paper and write this down, because the answer is B. They can't have wheat and barley. So celiac disease patients must avoid gluten, a protein found in wheat, barley, and rye, to prevent damage to the intestinal lining. Question number 18. The most serious problem that wrinkles in bedclothes can cause is restlessness, sleeplessness, decubitus ulcers, or bleeding and shock. Why are we always saying, get the wrinkles out of the sheets, get the wrinkles out of their clothing? Why are we telling you to do that? Revealing the answer in 3, 2, and you all have it. Wrinkles cause bed sores. So wrinkles in the bedclothes can create pressure points on the skin, leading to the development of Decubitus ulcers, aka pressure sores, especially in immobile clients. All right, so when does restorative care begin? When do we start rehabilitating people? Is it A, as soon as possible? B, when the client is ready? C, when the client is discharged? D, when the client is diagnosed as terminally ill? All right, let's see what you got. Let's see those answers coming through. And yes, you have it. Rehab starts as soon as they enter your facility. So the answer is A. Restorative care aims to maintain or improve a client's level of function and should start as early as possible to promote recovery and independence. Question number 20. Before placing a client in Fowler's position, the nurse aide should do which of the following? A. Turn the client onto her abdomen. B. Explain the procedure to the patient. C. Flatten the entire bed. D. Remake the bed with new linens. All right, so what's the Fowler's position? What is it? Are we laying them down? Are we sitting them up? All right, so Fowler's, we're sitting this patient up. So before you put the patient upright, what should you do? And if you said explain it to the patient, you are right. It's like, hey, I was laying down. Why are you sitting me up? Oh, because it's mealtime. So explain the procedure, ensures the client understands what will happen, alleviating anxiety and gaining their cooperation. Question 21. During hand washing, and this is important during your skills test, you all. So during hand washing, a nurse aide accidentally touches the inside of the sink while rinsing the soap off. The next action is to A, allow the water to run over the hands for 2 minutes. B, dry the hands and turn off the faucet with the paper towel. C, repeat the wash from the beginning. D, repeat washing, but for half the time. All right, so you have a nurse who's evaluating you during your test, and your hands touch the sink while you are washing them. What is the safest thing to do for you and the clients in your care? And yes, Eticia, you have it. It is C. We're going to start all over again. So touching the sink contaminates the hands, requiring the entire hand washing process to be restarted to maintain proper infection control standards. In some facilities, you can just notify, hey, I've made a mistake when you're taking your test, and they will tell you if you need to start all over again or if you can just resume from the point that you have made your correction. Question 22. A patient with gout should limit which type of food? Is it A, foods high in purines, such as red meat and shellfish? B, foods high in calcium, such as milk and cheese? D, foods high in fiber, such as fruits and vegetables? Or D, foods high in vitamin C? When someone has gout, when they have those inflamed joints, those inflamed toes, what should they avoid? All right, revealing that answer in 3, 2, and Carlene and Kelly and Vera, you have it. It is foods high in purine, so the answer is A. So they can't have like liver, anything that's like organ meats they have to avoid because it increases their uric acid levels, thus worsening their gout symptoms, aka their pain. Question 23. An ambulatory client is newly admitted. What does ambulatory means? It means this person can get up and walk without assistance. So an ambulatory client is newly admitted. Before leaving the client alone, the nurse aide should, the nurse aide should A, ask if the client is hungry. B, inspect the client's skin. C, assess the client's intake and output. D, make sure the client knows how to use the call bell. And then McLean, I think that's how I pronounce your name. I don't understand your question. Oh, yes, you'll be able to review it again. It's actually saved. So you'll be able to see the rebroadcast later since you're working. And thank you for trying to work and learn. I appreciate that. All right, so everybody, we don't care if they're ambulatory, non-ambulatory. When you get a new admission, you have to make sure that that person knows how to use the call bell. So it is D. Ensuring the client knows how to use the call bell promotes their safety and ability to call for help when they need it. You are going higher up. Answer my question, please. Kelly, there's a lot of things going on right now. So I do give you all my email address. So you can either retype your question, but I'm at the bottom of the comments now. So I can't really go back up. All right, so 24, when lifting a heavy object, the correct method would be to bend at the A, waist, keeping your legs straight, B, waist, rounding your shoulders, C, knees, keeping your back straight, or D, knees and waist. You're lifting something heavy. What is the best way to bend? And you all have it. Great job. Baby, we use those strong muscles in our legs. It's going to be C. So proper body mechanics such as bending at the knees while keeping your back straight prevents injuries to the nurse aid. Yes, you're going to do great on your test. Question 25, you all. What dietary recommendations is most appropriate for a patient with osteoporosis? Is it A, high protein and high sugar diet, B, high calcium and vitamin D rich diet, C, low calcium and low sodium diet, or D, high carbohydrate and low fat diet? What dietary recommendation is the most appropriate for a patient with osteoporosis? Osteo referring to bones, porosis referring to the weakening. So what are we going to be giving this patient? To build their bones. Think about it. Yes, Liz. Yes, Mila. It is B. They need some calcium and some vitamin D because it's essential for bone health and it helps to prevent bone density loss in osteoporosis patients. Great job, team. Question 26. When assisting a client with eating, one of the first things the nurse aide should do is A, cut the food into bite-sized pieces, B, wash his own hands and the client's hands, C, butter the client's bread, or D, provide the client with privacy. All right, let's see. Will they do I don't know who they are, Kelly, because I don't know where you're located. So I would ask that you contact your program where you were trained or that you contact the state. I can't answer such a specific question. All right, so everybody revealing the answer in 3, 2, and the answer is B. Don't start just cutting up their food with your dirty hands. So proper hand hygiene for both the nurse aide and the client reduces the risk of infection and ensures a safe eating environment. Question 27. A patient has a new cast on her right arm. While caring for her, it is important to observe for A, the pulse above the cast, B, color and hardness of the cast, C, warmth and color of the fingers, or D, signs of crumbling at the cast ends. All right, revealing the answer in 5, 4, 3, 2. I'm so proud of you. You got it. That's right. We're checking for circulation. We're not feeling for the pulse above the cast. We're feeling for the pulse either below the cast or we're looking at the coloration of the fingers. That will help us determine if the person's getting adequate circulation because if everything is pale, that means that cast is probably too tight. So monitor for signs of circulation such as warmth and color. It is essential to detect complications like impaired blood flow. All right, going to question 28. And we're going all the way to 60 questions tonight, team. So we're halfway done. And Kelly, I don't see your question. You said you're going to rewrite, so I hope I answered it for you. Question 28, encouraging the client to take part in activities of daily living, ADLs, such as bathing, combing hair, and feeding is A, done only when time permits, B, the family's responsibility, C, necessary for rehabilitation, or D, a violation of client's rights. All right, revealing the answer in 3, 2, and yes, Kelly, I answered it. You need fingerprints to be a CNA. Yes, ma'am. You cannot become a CNA if we don't know if you have a criminal offense or a criminal record. That would exclude you from doing so. So the answer, everybody, is C. Participating in ADLs helps clients maintain independence, improve physical function, and support rehabilitation goals. Question 29. In caring for a confused elderly man, it is important to remember to A, keep all bed rails up except when you are at the bedside. B, close the door to the room so that he does not disturb other patients. C, follow the agency's policies for caring for a confused patient. Or D, remind him each morning to shower and shave independently. And confused elderly man, what do you want to remember? That's right, because they could have very specific rules, whether it's behavioral health. Sometimes we have to do vital signs and rounds every 15 minutes, especially if they're Baker acted or if they have an acute mental or psychological issue. So you want to be following the facility's protocols. Following the agency's protocols ensures that care is provided safely and consistently while adhering to legal and professional standards. Did you all know that if you put 3 side rails up without a doctor's order, that is considered a restraint? So there are certain things you just can't do. You can't put this patient in the bed, put all 4 rails up, and put a tray over him because you've added additional restraints. We need a doctor's order for that. So follow the facility's rules. All right, question 30. Before assisting a client into a wheelchair, we know the first action. Is it A, make sure the client is adequately covered? B, see if the floor, it says the floor is slippery. C, door to the room is closed. Or D, wheels of the chair are locked. So which is the most appropriate action pertaining to the wheelchair? Revealing the answer in 3, 2, and yes, make sure the brakes are locked. Even when you take your CNA test, your clinical test, if wheelchair is your skill, after you do your greeting and wash your hands, go lock the brakes on that wheelchair. All right, question 31. A client has a weak left side. When transferring the client from the bed to the wheelchair, the nurse aide should stand on the right side, in front of the client, on the left side, or behind the client. This patient had a stroke. The right side is strong. The left side is weak. You're transferring them from the bed to the wheelchair. What side do you want to support? All right, revealing the answer in 3, 2, and you're going to support the weak side, you all. So the answer is C. I don't like how this question was worded, but hey, this is a question that we have. So the nurse aide should stand on the client's weak side to provide support and prevent falls during the transfer. So if you ever transfer somebody who has had a stroke or a weakness on one side, maybe they have a cast on their leg, they're going to lead with their strong side. So you don't have to totally pick up everybody. Some people you can assist on their weaker side, and they can stand without assistance on their strong side. So it'll make sense when it makes sense, but you help as much as you can. Question 32. A patient recovering from surgery needs increased intake of what? Is it sodium and fats, protein and vitamin C, carbohydrates and sugar, or calcium and vitamin D? What are post-surgical needs? What do you think, team? Great job, Ruthlyn. And I saw some other answers also. So great job. Yes, you all. Anytime you think of surgery, if we're trying to improve muscle tone, I need you to be thinking about protein. Anytime you think surgery, I want you to be thinking about infection. I want you to be thinking about vitamin C. So protein supports tissue repair and healing, while vitamin C boosts collagen production and immune function. Question 33. While making rounds at 5:30 a.m., a nurse aide finds a patient lying on the hospital floor. What should the nurse aide do? A, call 911. B, perform CPR. C, assess the client's pulse and respirations. D, call for help. This one's tricky. All right. I see it says B or C. It looks like wet line says C. All right, so it looks like I got a correct answer. I think it was Mima and Chrissy were the first ones who say, call for help, y'all. You got to call for help. I don't know if the person's homeless and they're just laying on the floor. But what I do know is that as a CNA, even if they do need CPR, you got to have a team there with you. So while it says call for help, so I need for you, even if the person, you see them on the floor, just go ahead and call for help. Now you can start doing a little quick assessment. Hey, are you okay? You can check for pulse and breathing, but at least now help is en route because you screamed for help like 5 seconds ago. So while assessing the patient's pulse and respiration is important, it should be done after calling for help to avoid delaying critical support. Okay, that nurse, if the person does need CPR, they're coming with the crash cart and everything else. So if you see something, you say something right away to get your team coming towards you. Question 34. The Foley bag must be kept lower than the client's bladder so that A, urine will not leak out, soiling the bed. B, urine will not return to the bladder, cause an infection. C, the bag will be hidden and the client will not be embarrassed. Or D, the client will be more comfortable in bed. Why must the urinary drainage bag, aka the Foley bag, be lower than the client's bladder? Yep, you all got it. You have the correct answer. We don't want the backflow, so it is going to be B. Keeping the urine bag below the bladder prevents the backflow of urine, which can introduce bacteria and cause a urinary tract infection. Question 35. As an afternoon snack, the kitchen sent a diabetic client a container of chocolate ice cream. The nurse and assistant should first A, substitute diet soda for the ice cream. B, hold the afternoon snack and report it to the charge nurse. C, call the kitchen and report the error. D, allow the client to have half of the ice cream. Well, if you did D, I know you would be her best friend. But when I come on and I don't let her have any ice cream, she's going to treat me like I'm her worst enemy. So let's follow the doctor's orders, you all. A diabetic patient should not have ice cream. So revealing the answer, shouldn't have regular ice cream, Revealing the answer in 3, 2, and... All right, so this one is B. Usually the CNA does not call the dietary or the kitchen directly. Definitely you have to remove that. You have to hold that ice cream and then you'll notify your nurse. So a diabetic client diet must be carefully monitored. Reporting to the charge nurse ensures the appropriate corrective actions can be taken. Question number 36. When assisting a client who is using a Commode, it is important to A, leave the call light within reach. B, lock the door to promote privacy. C, stand next to the client until the client is finished. D, restrain the client to prevent a fall. Let the people do number 1 or number 2 in peace. All right, so revealing the answer in 3, 2, and that is right, Miriam. That is right, Nima, and 70, and Harleen, is going to be A. They can be on the bedside commode if they're not a fall hazard, if they're not someone who's going to get up. They can be on the bedside commode without you standing right next to them. You just make sure they have a way to call you. So you have to leave the call bell within reach. All right. Yep, Davita, some of these can be B or C depending on where you're located. All right, so ensuring adequate circulation to tissue is a major factor in preventing skin breakdown. This can be accomplished by doing all of the following except A, performing passive or active range of motion exercises, B, using mechanical aids, C, giving back rubs, or D, repositioning the patient every 4 hours. How do we ensure adequate circulation? All right, so which one should we not be doing? Because this one has an except. Revealing the answer in 3, 2, and for this one, this can be accomplished by doing all of the following except. Yes, Asia. Yes, 70. We do not reposition patients every 4 hours, team. We reposition patients every 2 hours. So all of the other options actually improve circulation. When you do range of motion on a patient, when you're moving their joints, that increases blood flow. So that actually helps circulation. And then for the others, using mechanical aids. So sometimes those compression devices, those sleeves that circulate the blood flow, they have air in them. That helps with circulation. Also the TED hose. And then when you give a back rub, you do it in circular motions in order to aid in circulation. So A, B, and C actually help with circulation, while D, if you let somebody lay in a position for 4 hours, that's going to decrease circulation. And since this question asks what was the exception, D was the correct response. All right, so question number 38. The purpose of cold applications is usually to A, speed the flow of blood flow to an area, B, prevent heat exhaustion, C, prevent or reduce swelling, D, prevent the formation of scar tissues. Why do we put a cold compress on the patient? What are we trying to treat? That's right. I'm going to start putting it in the chat. So whenever you think about a sports injury, we use the acronym RICE. So the correct response is going to be C. We use cold to prevent or to reduce swelling. So RICE, if someone twisted their ankle, we're going to rest it. We're going to ice it. We're going to compress it, like put an ACE bandage on it, and we're going to elevate it. So RICE, rest, ice, compress, and elevate. So that is why we use cold applications. A warm compress for question 39 is an example of A, local moist heat application, B, generalized dry heat application, C, local dry heat application, or D, generalized moist heat application. Why do we put heat on somebody? What's the difference? And whenever we put a warm compress on a patient, is that generalized? Is it local? Is it moist? Or is it dry? Revealing the answer in 5, 4, 3, 2, and you have it. It is moist. It is moist, warm heat. So a warm compress applies heat to a specific area of the body, which makes it local. It involves moisture. Usually you take a warm washcloth. You can put it in like a Ziploc bag or something. If your facility does allow you to microwave it, you microwave for no more than like 10 seconds. And if it's too hot for you, it's too hot for your patients. And so that helps to improve blood flow and to reduce pain or stiffness in targeted areas. Whenever you think of heat, I want you to think of more chronic pain. When you think of ice, that would be an acute condition, such as somebody with a twisted ankle. Question 40. Clients receiving an enema are usually placed A, on their right side, B, on the left side, C, flat on their back, or D, in a semi-sitting position. And no, you don't administer the enema, but you would be the one who's putting padding on the bed and getting the patient ready for the nurse who administers the enema. So the nurse is usually not the one who's putting extra pads on. She's going to come and tell you, hey, I have to give Mrs. Lucas an enema. You're going to say, how long do you have? And she'll say 15 minutes. So you go in there, you put all the pads on the bed, and then when you're done, you have to have Miss Lucas in the correct position. And the correct position for an enema is going to be B, on the left side. Great job. Deroli, how did you get such a fancy cursive signature? All right, so the left side is referred to as the Sims position, and that's me with my interns. You all know they weren't giving me an enema, but they're putting it on draw sheet. So the left lateral Sims position is ideal for administering enemas as it facilitates the natural flow of the solution into the rectum and colon due to the anatomical structure of the lower gastrointestinal tract. So there you have it. You get in there, put those pads on, and put the bedpan nearby so that whenever the nurse gives that medication, that enema, hopefully the patient can hold it long enough for you to put the bedpan beneath them. If not, make sure your bed is fully padded or well padded. Otherwise, you're going to have bowel movement everywhere. All right, but the patient will have relief because they will finally have had a bowel movement. Question number 41. A female client's perineal area should be cleansed before which specimen is collected? Is it A, a 24-hour specimen, B, pediatric routine urine specimen, C, midstream clean catch urine specimen, or D, routine urine specimen? Whew, that was a tongue twister. All right, why do we have those wipes, those little wipes that we'll use to clean the woman for which type of urine specimen? Revealing the answer in 3, 2, and you all, it was C. So the reason why we do the midstream is because we need to wipe away some of those and flush out some of the bacteria. So cleansing the perineal area helps prevent contamination of the urine specimen with bacteria from the skin, ensuring an accurate test result. So at midstream, we don't capture or collect the first urine that comes out. We actually, as they're urinating, we put the cup beneath them midstream or instruct them to do so midstream. That way that initial bacteria will go in the toilet and not into our specimen cup. So that's the purpose of a midstream catch or clean catch specimen. Question 42. The most common site for counting the pulse is it A, carotid artery, B, femoral artery, C, brachial artery, or D, radial artery? Where's the most common site? And I'm so proud of us. We're up to almost midnight. I'm going to try this more often. All right, reveal the answer in 3, 2, and the most common site. Yes, it is D, you all. It's the radial artery. It's easily accessible. It's right there in their wrist. So the radial artery, located on the thumb side of the wrist, is the most accessible and commonly used site for measuring pulse in routine practice. We only go for the neck, the carotid artery, if the person is unresponsive. So when you think carotid artery, think emergency. Question 43. When counting respirations, the nurse aide should A, wait until the client has exercised, B, not tell the client what they're going to do, C, count 5 respirations and then check his watch, or D, have the client count respirations while the nurse aide takes the pulse. All right, so Kelly's in Missouri. She says it's 11 there. We're Eastern Standard Time. I'm in Florida, so it is almost 12 o'clock here. It's 11:54. So I know we have viewers from around the world. So let us know what time it is in your area after you answer this question. All right, so that's right. So this is the one time you go in the room and you say, hey, I'm here to do your vital signs after you introduce yourself, but you do not tell them that you are there to count their respirations because they will try to control their breathing. So the answer is B. Great job, everybody. If the patient knows their respirations are being counted, it may alter their breathing rate. They're looking at you, looking at them, and now they're not breathing, so it won't be accurate. So whenever you take your test, especially if you're taking your CNA examination with Prometric, you are allowed to say the word vital signs instead of saying that you are counting someone's respirations. That keeps the element of surprise. All right, so it looks like the day is in Minnesota and it's 10:54 there. Cladani is 11:54 where she or he is. There we go. All right, so question 4014. Which of the following is not the nurse aide's responsibility when caring for a client with a urinary catheter? Is it A, preventing infection, B, ensuring a catheter drains properly, C, inserting a catheter, or D, recording urinary output? A lot of people in the East Coast. We see New York, we see New Jersey. So welcome everybody. All right, so which one is not your responsibility? Which one would be the nurse's responsibility? Revealing the answer in 3, 2, and you all for question 44. As a CNA, not a patient care tech, remember when you're taking this test, it's the basic level. You cannot insert a catheter. But we know once you're hired in a hospital, they teach you all these extra skills, but they also change your title. They don't call you a CNA. They'll call you a patient care tech or a patient care associate. So when you're taking your test, you cannot perform sterile technique and you cannot insert anything into someone's body because inserting a catheter is a skilled nursing procedure and nursing assistants are not taught to do so. When you're in the hospital, they'll teach you more, but they also change your title. Okay. All right. So question 45. When giving information to the charge nurse for an incident report, the nurse A should A, state the facts clearly. B, keep the information in her personal file. C, write in the client's chart that an incident occurred. D, give her opinions as to the cause of the incident. Well, I knew she was going to fall because the nurse had did such and such, and the other CNA had did ABC, and her family had did XYZ. So, of course, it's not going to be D. You're not going to be giving your opinions. What is the correct response? Yes, I see so many correct answers. So, the correct response is A, because it's asking what are you going to be doing with the charge nurse? And you're going to be giving the charge nurse the facts and nothing but the facts. If you decide to keep information for yourself, you write a little note. That's something you do off to the side. And we usually do not write in the patient's chart that an incident report was filled out. We write in the chart what happened. Patient found on the ground, had a bruise to the left arm. That's what we write. But the incident report, usually we do not document that in the chart. So follow your facility's requirements. But incident reports must be factual and objective to ensure accurate documentation. Opinions or assumptions should not be included. So even if the patient said a swear word, we'll put the whole word in the chart because that's exactly what happened. Okay. All right. So question 46. For a patient with lactose intolerance, the CNA should recommend A, high fat and high protein meals. B, increased consumption of dairy products. C, avoiding fruit and vegetables. D, soy or almond milk as alternatives. Someone has lactose intolerance. You need to know what they need to avoid. So, what would you give them? Revealing the answer in 3, 2, and that is right, Miriam and Mima, Carlene, and Jartu, and Chrissy. We're going to give them soy or almond milk as alternatives. They can't digest the protein in traditional milk. So, patients with lactose intolerance, they can substitute dairy with lactose-free options like soy or almond milk to prevent gastrointestinal discomfort. We only have 14 left, team. Great job. We're going all the way to 60. So question 47. A resident is blind. It is important not to A, leave the door completely closed, B, rearrange the furniture, C, announce yourself before entering the room, D, explain the location of food on the plate using the face of the clock to assist. So which one should we not do? Revealing the answer in 5, 4, 3, 2, and looks like my art may have had it first, but we're not rearranging their furniture, you all, because they know that it's only 3 paces this way and 4 paces that way to get to the sofa. So we don't want to be rearranging things without letting them know ahead of time, because blind residents rely on familiar layouts for mobility and safety. Rearranging furniture can disorient them and increase the risk of falls. So just don't leave things out. If I don't care what it is, it could be a book. Don't just put things on the floor because they may not know it's there and they can trip or they can hurt their foot if they kick it by mistake. Question 48. When measuring blood pressure, the first sound heard when deflating the cuff is the A, systolic pressure, B, diastolic pressure, C, mean arterial pressure, or D, pulse pressure. So the first quarter cuff sound, the first sound heard represents what? All right, let's show you the answer in 5, 4, 3, 2, and yes, Zen. Yes, Nade. You have it. The first sound heard would be the systolic pressure. All right, so the systolic pressure is the first sound heard when blood flow begins to return as the cuff is deflated. The last sound heard would be the diastolic. So the first thump would be systolic, and the last thump would be diastolic. And I do have a video on my YouTube channel that shows you how to read a blood pressure cuff and also how to take a manual blood pressure. Question 49. Which of the following is a priority when a patient's blood pressure is 86/50 millimeters of mercury? A, place the patient in a Trendelenburg position. B, report to the nurse immediately. C, document the finding and continue rounds. D, ask the patient to drink water. I see a lot of A's and I see a lot of B's. And yes, remember, even though you know what the nurse is going to order, you are not the nurse. So it is going to be B. You're going to notify the nurse, who will then tell you if this patient should be put in the Trendelenburg position. Remember, we can't put everybody in Trendelenburg because if they have a tube feeding or if they have respiratory issues, we're not going to turn them upside down on their head. So a blood pressure of 86/50 indicates hypotension, which may signal a critical condition requiring immediate intervention. So you notify the nurse, who will then tell you what position the patient will be best in. Question 50. A patient is bleeding heavily from a surgical incision. What is the first step a CNA should take? Is it call 911, notify the nurse, elevate the patient's leg, or D, apply direct pressure to the site? They are bleeding heavily. What's the first thing you do? All right, give you 5 seconds on this one. Think it through. Revealing the answer in 3, 2, and for this one, looks like Zen has it and Chrissy has it. For this one, it's not notifying the nurse first. This patient is going to bleed out on you while you're trying to press that button. You throw some gloves on and you apply direct pressure first. And then with your other hand, you can call the nurse. But let's slow down that bleeding because they are bleeding profusely. They're bleeding heavily. So applying direct pressure helps control the bleeding while waiting for the nurse to intervene. So for this one, we got to immediately go hands-on. And if you can't get to the device, if you can't get to the call light or the panic button, you're going to scream help from your room. And that way you can get some care or some assistance to your room because I'm sure you're going to need gauzes and some other items. So please make sure your patient doesn't bleed out while you're waiting for the nurse to come. Question 51. A CNA notices a coworker consistently skipping assigned task. Oh, you're with the lazy coworker today. What is the best first step to address this issue? A, report the coworker to management immediately. B, speak to the coworker privately about the concern. C, take over the coworker's task to avoid conflict. D, ignore the behavior unless it affects patient care. You're working with a coworker who gets all the smoke breaks and you don't get a break. Sorry, that's not funny. But it's realistic. All right, so what do you think the best response is, team? I see A's, I see B's. I know you're torn. Do you want to report it? The problem with reporting it to the manager is that the manager is going to ask you, did you speak to your coworker first? So we have to communicate. It's going to be B. You would think that you wouldn't have to, ask someone to, hey, whenever you leave the floor, your call lights keep going off. And I don't know where you are, but yeah, you have to speak to that coworker first. So addressing the issue privately and professionally can often resolve misunderstandings or encourage accountability before involving management. So please speak to your coworker first. And if that doesn't work, that's when you can involve your supervisors. Question 52. A coworker refuses to assist with transferring a client, claiming they are too busy. What should a CNA do? Refuse to perform the transfer alone. B, attempt to transfer alone to save time. C, report the refusal to the supervisor. D, ask another staff member for help. Give people grace, you all. What's the best answer? Yes, Liz. Yes, Mima. What if they actually were busy? So you just don't want to go and report it to the management because maybe the person was too busy to help you. So you're going to do D. You're going to ask another staff member for help. So ensuring patient safety is a priority. You're not going to do it alone, but you will find assistance from another CNA or go ask your nurse to help you. Question 53. When assisting with a patient who has a nasogastric tube, so that's a tube that goes from the nose down into the stomach, the CNA should A, remove the tube if the patient complains of discomfort. B, change the feeding formula as needed. C, monitor for signs of aspiration, such as coughing during feeding. Or D, flush the tube to ensure patency. Someone has a nasogastric tube. What is the CNA's responsibility? Everybody has it right. That is right. It is C. We're monitoring. So CNAs must observe for aspiration signs, as this can indicate improper tube placement or feeding complications. Tube flushing and formula changes are performed by nurses. Question 54. What is an important observation to report for a patient with a nasogastric tube, or NGT for short? Is it A, clear nasal drainage, B, new onset of nosebleeds, C, normal bowel sounds, or D, soft formed stools? What would be an important observation? That is right. Anytime we say bleed, anytime we say bleed, you have it. It is going to be B, you all. So we would expect a person with a nasal gastric tube to have sometimes hypoactive, could be normal bowel sounds, but that's not something you'd be listening for as a CNA. What you could detect would be nosebleeds. It's going to be B. So nosebleeds may indicate irritation or trauma from the NG tube and should be reported to the nurse promptly. Question 55. While assisting a patient with an IV, the CNA notices redness and swelling at the insertion site. The most appropriate action is to A, adjust the IV flow rate, B, stop the IV infusion, C, notify the nurse immediately, or D, apply heat to the area. Redness and swelling at the insertion site. Yes, yeah, you all have it. It is C. You're going to notify that nurse. Redness and swelling may indicate infiltration or phlebitis. The nurse must assess the site and take the corrective action. And sometimes you all are going to have patients who are confused. And this confused patient is telling you, hey, my arm hurt. Hey, this catheter hurts. I need for you to believe that confused person, because at that moment they could be actually telling you the truth. And because you just said, oh, she's confused, she doesn't know if her arms hurt, you didn't even pay attention to the fact that her arm was now swollen from the IV that had infiltrated. So I need for you to take that extra moment and to listen to your patients if they're discussing pain. Even if they are confused, they may not be confused about the pain they are feeling. All right, so let's go to our next question. Question 56. An agitated resident must be turned every 2 hours all night long. The first action of the nurse aide when waking up this resident is to A, turn on the light, B, speak quietly and calmly, C, touch her shoulder, D, shout her name. So in other words, which is going to cause this patient the less amount of stress or distress? Yep, if you just walk into a confused person's room or an angry person's room and you just cut on the light, you're gonna get it. So we're not gonna do A, we're gonna do B. We're gonna speak quietly and calmly. We're always trying to de-escalate because it reduces agitation and confusion, hopefully making the resident cooperate with care more. Question 57. The CNA observes that the area around an IV insertion site is cool to touch and swollen. It didn't say hot and inflamed. It said cool to touch. This could indicate, is it A, phlebitis, B, infection, C, normal IV functioning, or D, infiltration? Cool and swollen. All right, so we're teaching you something new. Usually for infection or phlebitis, it's going to be warm and red. But if it's cool and swollen, that is de-infiltration. The reason why it's cool is because those IV fluids have left the vein and has filled the area surrounding the vein, is trapped beneath the skin. Thus, that cool IV fluid has now made that entrapped area within their arm also cool. So coolness and swelling at the IV site suggests that the IV fluid has leaked into surrounding tissue, which is a sign of infiltration. And these are some severe cases, but hopefully it won't happen at all. But if it does happen, you catch it when it's just a mild case. because it can actually cause blisters, and it's a very bad condition if we don't stop those fluids in time. Question 58. A patient with a nasogastric tube appears bloated and complains of abdominal discomfort. The CNA should suspect A, overfeeding or delayed gastric emptying, B, dehydration from inadequate fluids, C, formula intolerance, or D, infection at the insertion site. Somebody with a nasogastric tube, they're bloated and their stomach hurts. I see you're torn between A's and D's. So for this one, yes, Carlene, yes, Mima, it is going to be A. Now, they don't have control over what they're eating because it's probably connected to a feeding tube. And a feeding tube is putting this fluid into their body, and maybe it's not digesting properly. So if you just kept eating and kept eating and kept eating, your stomach would hurt too. So everybody, it would be A. That would be a sign of overfeeding or delayed gastric emptying. They're not digesting it. So abdominal bloating and discomfort may indicate what we just said, and that is when you would notify your nurse. And if you are able to check residuals, if that's something they'll teach you, of course, your hospitals will, but in the nursing home, that would be the nurse's responsibility. And the residual will tell us how much of the feeding is still in their stomach. So if we know if we need to contact the doctor to hold the feeding or to reduce the rate. Question 59. A patient with an NG tube starts coughing during feeding. Oh my, what should the CNA recognize as the most likely cause? A, the patient is having a reaction to the feeding formula. B, the feeding pump has malfunctioned. C, the NG tube has become dislodged. Or D, the patient is experiencing aspiration. They're coughing while the feeding is going. Now, this isn't a regular cough. This is a special cough. This is a moist cough. They look like they're in distress. So what does that indicate? And if you chose D, you are right. So the patients with those NG tubes, they can aspirate also. That's why we usually have them sitting up at about 30 degrees. If we lay them flat, we have to pause the feeding. So whether it's an NG tube or a gastric feeding, we have to pause it because the food can travel up. And then whenever we sit the patient upright, when the food goes down, it may not go down into the stomach, and it can actually go into the lungs. That's why this person is coughing so much. So coughing during feeding is a classic sign of aspiration, which can occur if the tube placement is incorrect or if the patient cannot handle the feeding rate. So if a person, and sometimes they will even put dye colors in the tube feeding. So we know if the patient coughs up something that is maybe has a bluish coloration to it, we know that they're coughing up tube feeding. So that would be a way for us to know the difference. And our last question, everybody, question number 60. The CNA observes foul-smelling, cloudy urine in the drainage bag of a patient with an indwelling urinary catheter. What should the CNA suspect? A, the patient has consumed too much protein. B, the catheter tubing is too long. C, the patient may have a urinary tract infection. Or D, the drainage bag needs to be emptied. All right, we'll reveal the answer in 5, 4, 3, 2, and you have it. It is C. Foul-smelling cloudy urine is a common sign of a UTI, and you need to be reporting that to your nurse. And of course, I got one more bonus question because you all have stayed up in some areas after midnight to practice, and I appreciate you all so much. So, of course, all the answers are good because we don't do anything negative over here. So let me know if you enjoyed the video, and if you did enjoy the video, give us a thumbs up. If you haven't subscribed to our channel, go ahead and make make it official because this week I am making it my business to come on here 5 days. I don't care what happens. I'm coming on here 5 days next week so I can make sure that you all get the preparation you need to pass your CNA and your nursing test. So you all, I will stick around for a few moments to see what questions you have. But here's our contact information. Again, this is Nurse Eunice with Florida Training Academy, and I appreciate you all so much. So thank you all for joining and give yourself applause. Great job, team. Yay! All right, and so I'll stick around for about 2 minutes. I know, Kelly, I answered your question a few times, but yes, you must have a background screening done. So those fingerprints done to be a CNA. Were there any other questions that I missed? And you all are so welcome. All right, so you're welcome. You're welcome. And then Kelly, I see you said good night. So good night, Kelly. Get some rest. And then tomorrow morning, I'll just do a simple video. I think I'll do one on like most interesting medical conditions or something like that. It may not be anything related directly to CNA, but of course it's going to be something interested in medically related. And then tomorrow evening, I'll do another CNA video. So you need to know the classes for passing meds, please. I don't have the dates, but I do have medication classes for this upcoming week. I'll try to do better about pre-posting the dates and the times so that you all will know the actual dates and times of the upcoming videos. So I'm holding myself accountable in 2025 to do better with my scheduling. And then the day, good luck on your test, which is next week. Wet line, I know tomorrow mornings will be at 8 a.m. But again, that's just it probably won't be on anything CNA related. So we'll say tomorrow at 7 p.m. will be the CNA test. And let me write that one down. So another practice CNA exam tomorrow at 7 p.m. Eastern time. And you're so welcome, Miriam. All right, everybody. I appreciate you all. Get some rest, and I'll see you all back here tomorrow. It's going to be in the day tomorrow at 7 p.m. Eastern Standard Time. All right, everybody. Bye-bye.